I've just come from a very interesting session where, along with my colleagues George Follows from Cambridge and Anna Shu from Oxford, we discussed the unmet clinical need of patients failing Ibrutinib or Idelalisib. And this has become a real problem since these drugs transformed the treatment of CLL. And we now have a licensed therapy, Venetoclax, indicated for patients who've failed BCR antagonists. And this drug is showing very promising efficacy with very high response rates and impressive progression-free survivals over 2 years in some of these difficult patients. Whereas we know from the real-world data that Ibrutinib failure was associated with very poor outcomes. So this is another example of a stepwise transformation of treating relapsed CLL. So we discussed a number of issues, including the trial data from the published studies, but also the emerging real-world data from both the US and the UK, showing that we can replicate some of these outcomes in patients that we see in everyday practice, patients with a poorer performance status or high-risk p53 deleted disease. They seem to be benefiting similarly to patients who went into the original trials. This is a really important drug for our patients. It's now licensed, it's funded in the UK, aligned with the license, and so it's not a definitive solution for relapsed CLL. There is a pattern of relapse, but the achievement of MRD negativity is a real game changer in this patient group.